My topic provides for children with gastroenteritis. Introduction. Concept. Gastrointestinal illness are a major cause of morbidity and mortality in children in developing countries, with eating disease being one of the top 5 causes of death in children younger than 5 years. Worldwide, the most important entering pathogens in rotavirus. Other major pathogens include Escherichia coli, Vibrio cholera, and Shigella. Campylobacter, Salmonella, and Cryptosporidium species.
Every year, gastroenteritis accounts for 1.7 million visits to emergency departments by children in the United States. Probiotics represent an expanding industry with potential clinical benefits, but there are limited data supporting their use in this population. This multi-center randomized double-blind trial included 886 children between 3 and 48 months old who presented to the emergency department with acute intestinal infection, clinically diagnosed on the basis of 3 or more episodes of watery stools in a 24-hour period, and vomiting or diarrhea for less than 72 hours. The children were randomized to take by mouth 1 sachet of probiotic preparation containing Lactobacillus rhamnosus and Lactobacillus helveticus, or placebo, twice daily for 5 days. The primary outcome was the occurrence of moderate to severe disease, as defined by a modified Vesicari scale score of 9 or higher within 14 days. The proportion of children with moderate to severe disease was similar between groups. After adjustment for trial site, age, and pre-enrollment frequency of vomiting and diarrhea, the treatment assignment did not predict moderate to severe disease. The authors conclude that in children presenting to the emergency department with gastroenteritis, twice-daily administration of a Lactobacillus rhamnosus, Lactobacillus helveticus probiotic combination did not prevent the development of moderate to severe disease within 14 days. Full trial results are available at nejm.org.
Application in nursing. Evaluated effectiveness of probiotics of children 3 to 48 months of age who present to the emergency department with acute gastroenteritis. The hypothesizing that the percentage of children with moderate to severe gastroenteritis, defined according to a validated severity score, within days after enrollment with significantly lower among those who received probiotics than among those who received placebo.
Hi, I'm Dr. David Hill, and today we're going to be talking about how to ease the symptoms of a stomach virus. Now, stomach virus is a term that really covers a lot of different infections that infect not only the stomach, but often the entire intestinal tract. Usually, you have a stomach virus because of fever, diarrhea, vomiting, some abdominal discomfort. You should not, however, be having blood in your stool. That would not be a sign of a stomach virus. Vomiting up blood is not a sign of a viral infection. Severe abdominal pain, if you have a fever over 104 degrees, those are all things that would make you think you've got something more serious going on and need immediate care. However, if you have the usual stomach bugs, sort of a short-lived 24-hour set of vomiting and diarrhea and some discomfort, then you really want to try and get you or your child through this as easily as possible. The most important thing is to not become dehydrated. Obviously, you're having a hard time drinking. You're having a hard time holding down fluid. You're losing fluid through vomiting and certainly through diarrhea. But remember, it's important to keep putting that fluid back in. Even if you're vomiting frequently, you don't vomit all of the fluid that's in your stomach. You do keep some. So taking small, frequent sips of fluid is very helpful, even if you are intermittently vomiting. For young children, the best fluids to use are specially created fluids that include a balanced solution of salt and sugar. Some examples are Pedialyte, K-electrolyte, anything pretty much that ends in light you can count on being that sort of fluid. The sugar and the salt help bring fluid into the body from the intestines, and that's why that's so helpful. If diarrhea is a major component to the illness, you want to avoid fluids that could make it work, especially fruit juices, sugared fluids, things that have a lot of sugar like soda. Even Gatorade can have too much sugar. Often, when you're having a diarrheal illness, the body's ability to digest milk will be temporarily reduced. So milk may make the diarrheal symptoms worse for a few days, and you probably want to avoid milk. On the other hand, breastfeeding babies should absolutely continue to nurse through the diarrhea. This is precious fluid, and it might even make things better. Now, for people who are having a lot of diarrhea, also lactobacillus, which is an over-the-counter supplement, the good bacteria that help your intestines function. This may shorten the course of your illness. However, the key is, if you're not getting better after a couple of days, or if you have a young child who isn't getting better after one day, seek care. If urine output is decreased, there's no pee in an 8-hour period, you may need more aggressive rehydration done by IV fluids or even in the hospital. So be sure and seek care for that. But if you got one of the usual bugs, remember, keep drinking and take it easy till you get better. Talking about easing the symptoms of a stomach virus, I'm Dr. David Hill.
Pros and cons. Probiotic has been commonly used for the provision and preservation of organs of foods. Ergots come from the green. For lice is proven in various studies that when the probiotic gets to interact with the mucosa, it will be able to stimulate the responsive primary immune.
Hello, this is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about gastroenteritis, bacterial to be more exact. Vomiting and diarrhea together is called gastro for vomiting and enteritis for diarrhea, also known more commonly as the stomach flu. Your physician believes that your illness was probably caused by a bacteria. Gastroenteritis is the medical term for a stomach and intestinal infection. This infection causes nausea, vomiting, diarrhea, crampy abdominal pain, and fever. Diarrhea may sometimes be bloody. Diarrhea is the main symptom of gastroenteritis. Vomiting without any diarrhea should not be blamed on gastroenteritis. Gastroenteritis is treated with medicine to help nausea and diarrhea. It might help to avoid eating for the next day. Instead, drink clear liquids like water, broth, or juice that has been diluted or watered down. Avoid large, heavy meals that may make you sick to your stomach. When you start feeling better, you can eat more. You will probably feel better in a few days, but it might take up to a week. Here are some pictures of what is considered the BRAT diet, B-R-A-T. Your physician believes that this infection is caused by a bacteria because the severity of the symptoms, history of exposure to an infectious agent, drinking from well water, travel outside the country, or bloody or mucousy diarrhea. He will prescribe antibiotics based on this suspicion. If cultures were done on your stool, then you must follow up the results with your primary healthcare provider to make sure that the antibiotics prescribed today is effective against your particular infection. Talk to your regular doctor if you don't feel well or you have new symptoms or concerns. Otherwise, you don't need to follow up for simple, uncomplicated gastroenteritis. You should seek emergency medical attention if you have the following symptoms, like getting worse, you feel weak or dizzy, you cannot keep clear liquids down, if you have bloody diarrhea even after treatment, if your stomach pain gets worse, or if you don't feel better after the treatment. For more videos like this video, please visit edxitvideo.com. But remember, these are educational videos and should never replace the care or attention of a medical healthcare professional. Please like my videos and subscribe to my channel.
peaked in Ecuador. In cleaner products for adults and children provide live bacteria that are intended to have a beneficial effects in the host are frequently recommended to avoid a variety of real. The result of thousands of studies of probiotics has been published, and most of them have shown that probiotics are effective in treating or preventing various forms of acute and chronic real acute infectious gastroenteritis in children remains a major public health issue, particularly in low-income countries where this condition accounts for significant neonatal mortality. Followed out from one study, that injured more than 20,000 infants.
Every year, millions of children worldwide get an episode of gastroenteritis. Gastroenteritis is caused by one of several germs, is characterized by vomiting and or diarrhea. Our gut has a lot of bacteria in it. Probiotics are members of gut bacteria that are believed to be healthy. They are a single bacteria taken out of the gut and grown up in a flask and then washed and put into packages and sold as probiotics. For years, people have been giving probiotics to children with gastroenteritis in the hopes that it could shorten their illness or make their symptoms better. Dr. David Schneidauer asked a simple question. If children come into our emergency department with gastroenteritis and receive a probiotic or are randomized to receive a placebo, do the children who receive the probiotic get better any quicker? And the answer, after enrolling nearly 1,000 children over several years at multiple sites in the United States, the answer was a resounding no. That the children who received the probiotic got better at the exact same rate as the children who received the placebo. So my recommendation to a family would be that a probiotic in a setting like this is probably harmless, but it is certainly not going to shorten the illness. I would recommend that they not spend their money on it and save that money. Child gets better and invest it in fresh fruits and vegetables.
Conclusion. I lost compromised intervention culpable or result in the risk already in the early years of life, even with modern efficacy, will have an enormous impact on the developing world. Assuming that efficacy is confirmed of prevention and treatment of children during in this sentence, and great deal of work will be needed for its real implementation.
Another name for the stomach flu is viral gastroenteritis, and it is an infection of the GI tract. There's many causes of it. Mostly it's caused by different types of viruses. Among the most common are rotavirus, which we usually see in children 2 and below, and luckily we now have a vaccine to help prevent that. The other virus that's gotten a little bit of press lately is the norovirus, which has been a common cause of viral gastroenteritis in cruise ships. The typical symptoms of viral gastroenteritis are vomiting and diarrhea, not always associated with a fever. The biggest thing that we worry about is dehydration. Dehydration is that the body is losing too much fluids. So in terms of dehydration, weight loss, decreased urine output, feeling tired, fatigued, irritability, and in some babies, when you feel their soft spot, it can be sunken. It is spread person-to-person contact is the most common way that it's spread. So in terms of like prevention and things like that, we always kind of stress good hand washing, good personal hygiene. And then, like I said before, luckily we do have a vaccine to help fight against the one specific type of virus, the rotavirus, especially for our children. In terms of treatment, we treat with fluids, so small amounts of fluids frequently. Initially, we like to treat orally, so there are commercially available oral rehydration solutions like Pedialyte. You can also use water, ice chips, Jello, popsicles, things like that. If the patient isn't successful being orally hydrated, we will unfortunately have to use IV fluids, and that usually entails either inpatient admission or ER visit. Sometimes some people will use like juices or sports drinks to help hydrate. Even though it helps increase and improve the salt loss, it may, because of the sugar load, may add to an increased number of diarrhea. So typically, that's why we like the commercially available oral rehydration solutions.